This video is an overview of the cleaning and care of the Midmark barrier-free examination chairs. Always refer to the appropriate technical documentation for the complete list of instructions, safety alerts, and sequence of procedures before conducting any service or maintenance operations. All disinfectants and cleaning agents damage your chair upholstery to some extent. However, it is our goal to give our customers guidance that supports a long product life. Your Midmark upholstery can provide your facility years of service if you follow these guidelines. Always remove any spilled fluids immediately. Wash your upholstery weekly with a mild liquid soap and water mixture. Rinse with clear water and dry completely to remove disinfection and cleaner buildup. To disinfect your Midmark upholstery, we recommend using a 10% solution of standard bleach and water as recommended by the CDC. First, position the table in the flat position. Disinfect, rinse with clear water, and wipe with a clean towel or cloth. To minimize disinfectant or cleaner residue buildup, do not allow disinfectants to pool on the surface. Once the approved contact time has been obtained, remove and dry any excess liquid remaining on the surface. We recommend that you wipe all surfaces with a clean, damp cloth daily. Always make sure the upholstery surface is completely dry before applying table paper. Visit the technical library on midmark.com for the suggested pre-mixed disinfectants list that Midmark has tested and recommends. Please note that certain substances used during procedures like iodine-based antiseptics may cause permanent staining. Make sure to protect all surfaces from these types of substances. Please refer to the user guide for complete guidelines. Painted metal, plastic surfaces. We recommend cleaning the painted metal and plastic surfaces weekly using a clean, soft cloth and mild cleaner. Periodic inspection and adherence to the following guidelines will help to ensure proper operation of your table. Power cords should be free of cuts or other visible damage. All fasteners should be in place and tightened securely. All mechanical functions should operate properly. Periodically, lubricate the back hinge using light machine oil to maintain quiet, smooth operation. We recommend that you have an authorized service technician inspect your equipment every 6 months. For more information about Midmark barrier-free examination chairs, contact Midmark Support Services at 1-800-MIDMARK.